fine.
Okay. This
Yeah.
is bottled soda water. It's not beer.
Oh, uh, so here
Okay,
we
got
go.
it.
I'm gonna
Okay.
wonderful. We are live stream now.
I got the right shirt on. Oh,
Wonderful.
oh, boy, it was tough.
So everybody is watching us right now.
Oh,
Hello,
they're watching
everyone.
us?
Yeah, hopefully somebody will be watching us right now.
Oh,
Hello, everyone. Welcome back to my podcast YouTube video channel. Again, today I'm honored to invite my former mentor, Dr. Ivan Berger, come back again to this channel, and I'm very honored and excited that we have somebody that been in dentistry for more than 50 years. So Dr. Berger, welcome to the channel, and it's an honor.
well, thank you. It's an honor for you to work with you, Dr. Locke. You were an outstanding dentist then, and I think you've really have gone forward with all your further advancements in learning about the dental science. So you really are an expert in all fields. So I followed you, and I think you're fantastic. So congratulations.
Thank you, Dr. Berger, for your kind words. Uh, Dr. Berger, can you give us a quick journey about your career of dentistry? Really quick, because we talked about last time, but today
Yes,
my focus is going to be more like into a
I'll
little
make
bit
it real
more.
fast. I'll make it
Yes.
real fast. I went back to New York University. I had a choice of going to about three different schools, but I had never been to New York. And I'm originally from Washington, D.C., lived in California for over since 1949. And so I went to New York University 1954 to 1959, graduated, came back to California with my beautiful bride I met in New York, and started a practice in Simi Valley. And I practiced there between approximately 34 years, 35 years. I decided my son Herschel graduated from dental school, UOP, and I decided I wanted to retire. And I worked with him for about 6 months. And I said, okay, it's all yours. The ship is yours. You take it over. And I went into retirement, and we had a big earthquake, the Northridge earthquake in 1994, and so our home was pretty well destroyed, and we were living in hotels. And I figured, I wanted to do something different, and I saw there was an opportunity with a dental company in Orange County called Denticare. They were looking for someone to help them there. I went down there and interviewed, and they said, "Gee, would you like to be a dental director?" Because I've had a lot of experience with dental service organizations at the time, or we called them DHMOs at that time. And I said, okay, what does a dental director do? And he says, well, I'll tell you later when you do your interviews. And I said, well, how many days? He said, 5 days. I said, wait, I was only doing 3 days. He says, you'll like it. So anyway, I went there and they made me dental director at Denticare for several years. They sold out to another company called Smile Care. I became their dental director. Smile Care was sold out, and to a company called Coast Dental. It was from Florida, so I became the co-director on the West Coast with Coast Dental. And they finally sold out, and I said I had enough at that point. And we live down here in Palm Desert, California, where most of the months is pretty nice, and about the 80s. Today it's summer here. It's 115 degrees in the shade, 115 in the shade.
Well,
So that's
that's
it.
pretty warm, and but uh, finally you settle down. Uh, but from the past, over the years, you work with so many specialists and dentists, and you see so much train change, and now even there's the new things going on, artificial intelligence that we're going to talk a little bit about. But you see there is so much change. One of the biggest thing that the young dentist, or even before they become a dentist, that they tap on dentistry And the biggest concern, Dr. Berger, is the dental education costs.
Yes, yes.
So
It's
what is,
astronomical. It's astronomical.
yes,
I did some research on that. I was working with, it was for high school students that were interested in healthcare. So I did some research on that, and I found out that if you go to a state dental school, the tuition is going to be significantly different than if you go to a private dental school. And I think that the state dental schools today throughout the country are just as, your education is just as good as if you go to a private dental school. So, you know, if you want to travel out of state where you're at and you can meet the qualifications for a state dental school in another in a state other than where you're at, I would recommend doing that because that is a significant difference in the tuition. Um, the tuition is really horrendous, and I hope that there's something that can be done for the students today to lower that cost. I think it's, you know, not to get political about this, but I think it's a political issue with the student debt forgiveness loans. You know, every time that the students get a loan, the money is very easy to get. It's available while you're a student. Then the schools, they just up the tuition for no reason. I mean, their overhead probably did increase, but not to the point where they are today. So I think it's a sad commentary for students to graduate from dental school and have $200 to $400,000 easily in student debt loans when they graduate. It's a tremendous burden. You have to be able to put food on the table. You have to be able to pay for a car, pay for gasoline, utilities, and things like that. And meanwhile, you have this huge student debt loan with the interest alone that could be like 30, 40, 50 years. I mean, it's like incredible. So there are ways that you can help handle that, manage that student loan. I don't know if you want to talk about that now or you want to.
yeah, you can give some advice for the people that, you know, interested in dentistry, but they, as soon as they see the student debt going to be, they might say, you know, I'm not doing it. But you might give us some perspective, the positive and the negative, like if we pursue it, what kind of qualification we should prepare for we can be a dentist in this the 21st century. There's so many things, like, you know, your hands, your
Well,
knowledge, all of that.
I would say when you get out of dental school, the first thing I would do is set yourself a budget. You have to figure out what your income is and live by that income. I know that everybody went to undergraduate school 4 years, then they go to dental school for 4 years, and that's 8 years of schooling. And, you know, oh, I want to get a nice car. I want to get a really fancy car. Don't do that, okay? Make out a budget that you can live with and make arrangements so that you can pay the loan off as soon as possible. It doesn't mean you're going to be able to pay it off in 5 years or 10 years, but make an attempt to decrease the interest on the loan as much as you can and live with a budget. And that's one thing that my wife and I did. When we got out, we really had just about $0 in the bank. And I can remember that when we finally were able to get $600 in the bank, after our budget month was taken care of, we had a surplus of $600. I thought we were the richest people in the world. So from there on, I always worked out a budget, and really tried to keep to that budget, because it's very easy with a credit card to, oh, it's only $10 here, it's only $20 here. I'll go out to dinner here and spend $50. You know, I worked hard, I need to deserve that. Those things add up, and it just increases your debt load. So make a budget, do the best you can to live with that budget. That's what I would say. And then make plans to try to decrease the student loan.
Dr. Berger, before we even go to become talking about like the new dentist, I'm talking about like the encouragement or the recommendation for somebody who thinking about dentistry or medicine, and as soon as they heard about the debt, they say, well, you know, it's not worth it. And at first, you have a son in dentistry, you work with a lot of dentists. If you can say something about those who want to go to
I've
dentistry, what would you say to them? Like, what should they prepare for them just to be into dentistry?
I think dentistry really is really a tremendous profession. There's really great opportunities. I mean, you have a chance to work with people, to help people to improve their smile, and it's not only smile improving today; it's also improving their medical health, because
Yes.
so much is related from the body to the oral cavity. I'm certain these young dentists know the connection between the oral cavity and the rest of the body, the coronary system, the blood system, the uh,
Yes.
diabetics. My younger son is a diabetic. He's an endocrinologist, and he deals with diabetes. And I think I read something where within the next 25 or 30 years that diabetes is going to be probably the number one disease problem that we face in the U.S. Due
Hmm.
to obesity, other factors involved with it. So it's a great opportunity to be in the professional care, to be able to work with people, to help improve their health, to make a smile. Because the first thing that people meet is a smile. So a
Hmm.
smile that's how we connect with each other.
Yes.
If we have a sad face, who wants to meet with people with a sad face? So a smile is really one of the greatest things that we can do, and have a really a wonderful, not only a smile but also a great dentition, and keep your teeth, help keep people's teeth for as long as possible. So I think
The,
that's very important.
yes.
If you really want, I mean, there's other things you can go. It's very rewarding, not only from a personal perspective, but it can be also from a financial. Okay, so once again, you can be financially secure if you watch what you're doing and set up retirement funds early in life. You'll have a nice retirement fund. You'll be able to enjoy yourself when you're 65. But I doubt whether you're going to retire when you're 65 today. It used to be 65 was the golden age. Today, I'm seeing dentists going into 80, 85 and
Yes.
still going strong. So
Yes.
it's a great life. It's a wonderful opportunity to help people. And I think
Yes.
that's why you want to be a dentist.
Dr. Berger, but on the other hand, there is the number of concerned dentists out there. They they fall into the situation where they work by themselves and they become very lonely, depressed, and so those are kind of issue that being a solo practitioner, we might end up become very lonely, and
And you're
and
right.
uh, yes, so
Absolutely.
so stuff like mental health, could you talk a little bit about like how do you deal with those people, like how to help those dentists? Because we have a lot of social media now in the group that help a lot of dentists out there, but still, in the end, when you walk home, you stay home, you can't talk to your wife if she's not a dentist, then there is a problem, and it's get worse. I see people take medication for that, and it's a big thing.
Well, it's not only in dentistry, but it's in medicine as well. Okay, so
Yes.
it's a healthcare professional issue across all professions.
Mm.
Um, sometimes professional counseling would help a doctor. You know, once again, you have to figure out in the beginning how you want to practice.
Hmm.
Okay, and what type of practice you want to have. And by that I mean, do you want to have a very small practice? If you're looking to have a lot of HMO patients in your practice, then you're going to have to work extra hard. And so the pressure of going from room to room, from operatory to operatory, handling that caseload is really, it's a grinding thing.
Hmm.
I see that with both of my sons, the one that's a dentist, and I see it even more with my son that's the endocrinologist. He's probably been in it now 35 years, and you would think, okay, he's got a full practice. He's in a group practice, and he comes home every day really just really exhausted. So it's a difficult thing. I really don't know how to answer that question, other than how you want to practice in the beginning of your practice. And I think if you just, I mean, there's some things I could talk about that if that's what you want to know.
What I'm saying is, for example, there's a lot of dental coaching, mentor, consultant, advisor, dental advisor. Those people, do you believe they can help those dentists to set the path at the beginning, or should they do when they work for a while and figure it out? Or there's many ways to go, but these days we have overloaded way of helping people, from social media to coaching to personalize your practice individually. So many things they can help. But so yeah, what do you think about that?
Well, okay. What I would say today, if from day one you're out of dental school and you're not going to go for a extended 1 year GPR and you want to start practice, I would not open your own practice. I think that would be disastrous. I think you need to look around and find a dentist that you can go into practice with as an associate. There are a lot of ground rules on that. What you need to do in preparation for that, how you're going to practice, what's going to be your relationship with this dentist. Is this dentist eventually going to sell the practice? And if so, are you a prospective buyer for the practice, or do you want that practice? And if you just want to go into that practice just to get some income and develop further skills without thinking of going, buying that practice, that would be one way to go. Another way to go to be evaluate if that's a practice that you would like to buy, maybe 5 or 10 years down the road, where that dentist, where you and that dentist have established a really strong relationship and a mentorship that you've learned that would help you very much to buy that practice. So I think that's a couple of things. You can just go in if you just want to increase your skills and earn an income. Then you can go into one of the large DSMO practices. It's a lot of work. You're going to be, under a lot of pressure to produce. You're going to see a lot of patients. It's very fast paced. But you're earning an income, and at the end of the day, you earned your income without it. And then after a certain amount of time, you've developed skills and you've had a sufficient income, then you may want to look around to get into a practice, once again, as an associate, and go part-time as an associate and part-time as in a DSO practice.
So a lot of time people ask me a question like, when should I start open my own practice? And the way I answer them, it's based on how good you are when you start. It could be 1 or 2 or 3 or 4 or 5 years, depend on the level of competence that you are when you work with an office. So I'm not sure, would that be something, would you agree, or would you give a better advice?
I really think you've got excuse me, you've got that debt load from dental school. You probably have some additional debt load from undergraduate school in that. Okay, so you got a combination of both of them, which could be several $100,000s.
Yeah.
After 1 or 2 years as an associate someplace, and you think you want to own your own practice, I think today I wouldn't recommend it, because now you're going to take on another debt load if you can get a loan to open a practice, which is very expensive. So once again, I think that if you can go in with the intent that you either want to buy that practice, after you had the interview in depth with that dentist, I think that's the way I would do it today.
Yes, I agree. Because a lot of young dentists, they don't realize, like, let's say if they obtain an existing practice, that practice, it could be overrate or underrate, depend on how you look at that. If the dentist who sold the practice are a very good doctor, he probably done all the good work for the patient. Now just a maintenance. Or if he or she not so good, then there might be a treatment plan that the dentist can jump in and help. So it just depends on that too.
Well, there's a lot of factors. You certainly, when you go into that relationship, you want to know also what like number one, what is the turnover of his staff?
Mm.
Does his staff seem to be very stable, which would be an indication that that he's a very good practitioner? How many new patients is he getting? I mean, today with the computer, you can just spit that out. I'll tell you how many new patients there are, how many patients are having dental restorations, how many patients are on maintenance, how many patients are in perio recalls, how many patients are per month are doing crowns or implant restorations. So, and if that dentist is doing implants, uh, that's a great way to learn how to begin to do implants, simple implants, one implant at a time, and then restoring it. So there's a lot of things you want to go into. If you just want to go in just to make that income, then you don't have to do a great amount of research. But if you really like that dentist and there seems to be a connection, like I can connect with you and I say, well, look, Dr. Locke, I think maybe 10 years from now, I just want to retire. Okay. And I like the way you are. I like the interview that we had. I'd like to have you come into the practice. I'll help you with, develop the practice. And I'm certain that, on the number of new patients that come in, if I have a sufficient number of patients already in my patient load, I would give you those new patients to take over. And as being a young dentist, I would say, look, Dr. Locke, I don't do the implant restorations, but Dr. Locke can do those. Okay. And so I would refer those cases. So it has to be a trust relationship that you would develop. So if the mentor dentist or the owner dentist doesn't want to get into that type of relationship, then that's not the one you want to practice with. You just may want to work there and develop an income until you feel that you're stable enough. You can start looking around for another practice to go into. I think today that if you have your own practice, you really need to have some specialists come into your practice to help out, like for periodontics. Okay, so if you ever, a lot of the specialists today don't want to open their own practices. They would rather go to a few selected general dentists that they feel comfortable working with. They'll come into the practice maybe once a week or maybe once every 2 weeks, whatever it would be, and they would do your perio surgery. They would do your implants, and then you could work with restoring those implants. So you could do, that'd be a very good way to do it. You could also bring in maybe an orthodontist. So those are ways that you could, if you want to be in your own practice eventually, those are things I would say. So I think that would help compensate this loneliness, this isolation that dentists have. So I think that would be one way if you have these specialists come into your office. So I think that's an avenue.
Yeah, that's a good advice, Dr. Berger, for those who feel lonely. Maybe have a couple of specialists come to the office to change the atmosphere and get to know a couple of people, hang out for happy hour, lunchtime.
Absolutely, absolutely, yeah, definitely. My son, that's took over the practice. He has a periodontist. I think it's probably about 4 years, 3 or 4 years.
Mhm.
And I do know that on his implant side, that he certainly has increased the number of patients that have come in, because if you do like um, immediate denture with 2 or 4 implants, okay, whether they're zest over dentures or whether they're actually implants, that are screwed in to support the denture. Well, you just need a couple of those before that patient is going to be so happy to go out and show his friends, how he
Yes.
can eat and be happy, and his speech and just overall how he feels. So that'll bring more patients into the office, the referrals.
Absolutely. Dr. Berger, as far as do you see the trend that nowadays general dentists can do implant braces. Is that something that going to be disrupt the kind of specialty, or you think specialty gonna be still specialty?
I think you have to know your limitations. Okay.
Mm-hmm.
Okay.
Mm-hmm.
Um, if you do like single implants or even up to 2 implants, and you did like 1 or 2 patients like that, and they came out, the results were successful, we're happy. That doesn't mean that you're not going to get those that are going to have problems, that are going to have rejects of the implant that they don't osseointegrate. So I think if you know your limitations, a
Mm-hmm.
specialist will say, gee, okay, yeah, look, I'll show you how to do 1 implant or 2 implants. But that specialist, but then you're going to have patients where when you have a treatment plan, instead of 1 or 2 implants, you may want to do 4 implants. So that's when you say, look, I think in your particular case, Mr. Smith, 4 implants to help hold your lower denture in or your upper denture in really would be indicated, because you don't have much of because of the problems you had in losing the teeth and the loss of the bone support. You need more than 2. You need 4 implants. Dr. Locke comes into Dr. Locke is a periodontist that's in our practice, my practice, and I want you to see him. So that would be the same thing. Like if you had an orthodontist that comes into your office, okay, we'll learn how to do maybe simple movements of teeth. You're not looking to bond all 32 or all teeth. You're just looking to do a couple bonding to move maybe the centrals or the laterals into a better position so you can do the veneers. Okay, you can have the orthodontist train you on that, but meanwhile show you on that. But meanwhile, you're referring to the orthodontist full orthodontic cases. So once again, it's knowing your limitations, and
Mm-hmm.
everything is not going to work out. So when it doesn't work out, and you have a good relation with that specialist, you can say, well, look, the 2 implants, we've had some trouble with it. Let me send you to see Dr. Locke, and let's get this under control. And Dr. Locke's going to say, sure, I want to see him, because you're referring to Dr. Locke, okay? It comes into your practice. Or even if you don't come, Dr. Locke doesn't come into your practice, Dr. Locke's got his own practice in ortho or perio. But, you do some minor cases that he can show you how to do. And if you have, because you're going to refer all your tough cases and most of your cases to Dr. Locke, so Dr. Locke's going to be happy to help you out. But if you only send Dr. Locke the cases that you really have messed up, and you do that often enough, Dr. Locke's going to say, well, look, Dr. Berger, I don't think we have a really good, it's not going to work what we're doing, okay? Because Dr. Locke doesn't want to assume all that responsibility, because Dr. Berger is exceeding his limitations.
I
So
see.
once again, it's building that relationship, and that's not going to be done over 6 months or something. It's going to take a couple of years to build that relationship.
That's very important. I just want to thank you for your recommendation and advice for us, because sometimes seasonal dentists we just forget that building the relationship with a local specialist, whether it's oral surgeon, endodontist, periodontist, or implantologist specialist, is really that's how you protect your office as well. It's not simply like just keep working and ignore the neighbor, ignore everybody, and then when trouble come, then you reach out, and the specialist like, I never know you, I don't even know you, who are you?
That's
And
right.
so yes, yeah.
And I would say another, I don't know how much time you have, but I think it really important would be for young dentists to join the American Academy of General Dentistry. Join that, go to the meetings. You'll meet other dentists in your area or other dentists close by, and you'll develop relationships with those. And the specialist may have a study club. There may be a specialist in your area that has a study club where general dentists can come in and discuss their cases with the specialists. They love to do that, and
Mm-hmm.
the specialist can help the general dentist. So joining the American Academy of General Dentistry, work for a fellowship. I think it's really important to take those courses. It'll take time away from your family sometimes. It can be a little bit expensive, but I think that it'll be rewarding down the road. A huge return for the time and the financial that you've invested. I would definitely do that.
You always encourage dentists to achieve to get more education and constantly renews the knowledge. And I know you talked about that before. And one of the things you said before is I really like it. Dr. Berger, when you said that there's nobody can take away from your degree, and you just have to remember it.
Absolutely,
when you are
absolutely.
so down, when you are
Yeah.
so on the bottom, just
Yep.
remember that you already accomplished something, and just encourage yourself. And
No one can take that education away
yes,
from you. And
yes.
I was taught that from the day one from our dean. He was a prosthodontist, a very upright, probably about 6'1", 6'2". He was from Boston. He was as Bostonian as you could be. And but he said, the one thing I want to tell you is that no matter what happens, they can never take your education away from you. So, I mean, today it's a great thing to do today. Everybody wants to know about AI. There are a couple companies out there. I think that, be a little careful about that. I think that certainly is going to be something important. But for a new dentist to jump into AI, I think if I was a new dentist, where I would focus on would be developing intraoral scanning skills, learning how to do that. I think that's very important. Working with a lab so that you can send a crown by file to the lab. The lab will take it, create a working model, make your crown, send it back to you. Maybe you can get it in 2 or 3 days. Well, that's a great practice builder to be able to tell a patient, instead of wearing a crummy temporary crown, even no matter how good it is, it comes loose, or they eat something and they lose it. They call you up on the weekend and they want you to come in and re-cement it. So it's a great practice builder. Intraoral scanning, I think, is really one of the first things that you really need to learn how to do, and that would be very important.
Yeah, I agree with you. Dr. Berger, talk to us about your experience, the trip that you went to Israel.
Oh, well, we had never. My wife and I wanted. We had made several vacation trips on the Viking cruises throughout Europe. We had done that several times, and I am Jewish, and it from coming from a long time ago. I just felt that we wanted to go to Israel to visit and see the people and have a really great time. And we went for 3 months. People thought we were crazy. We rented a condominium, and we had the most fantastic time. I think I've told you about that. We traveled from north to south. People are great. The food is fantastic. We were very safe there. We went to the Tel Aviv, the dental school. Had a beautiful dental school there. They also have one in Hebrew University, has a dental school, but we went to Tel Aviv, and we met the dean. We just recently made a contribution to the dental school there, where they have a lab for imaging and the students learning how to take data from radiographs and make treatment plans in the imaging department that they have. So it was just a fantastic. We met friends that became very close friends that we contact by phone. We just spoke to our friends yesterday, and had a wonderful conversation with them. It's a fantastic country, and I encourage people to go there, regardless of what religion you are. All the religions had their birth there.
Right. Yes.
Every religion has its birth there, so everybody has a round hole that you can fit into the round hole. So it's not a round hole. So it's not being a round hole in a square hole. It's you can go there and feel comfortable and feel safe, and meet the young people. They're energetic. It's incredible how energetic they are. They're very young people, very family orientated. We went, as I said before, we went to the dental school a couple times, and we went into the cafeteria of the where the main university was. And when you're 18 years old, if you're a male, you have to go into the armed services for 3 years, and if you're a female, for 2 years. And every time we went in there, we always bought lunch or something and had a chance to talk to the young people. And it's just a great experience. I know you were there and you had a wonderful experience.
You were there 2019, right? Or 18?
2018, we went there, 2018. It was the 70th anniversary. I didn't know it was going to be the 70th anniversary.
Yeah. So that's it's incredible. Country only 75 years of establishment. Yes, right. But something I found out that the number one thing is the young people, they work hard. They work very hard, way overworking, and that's the reason why they develop technology, so much technology for the world.
Education is number one there. They really work towards your education system. They have a great education system, and the education system is open to all people, all people, whether they're Israelis or whether they're people that have come into the country, whether they're even Palestinians that have Israeli citizenship. They're open to the schools as well as to the university. So I don't want to get political. So no matter what you may hear on the social media, it's not really what's down there at the basic part. And so I think it's a very vibrant country,
Yep.
and that can take care of itself and will defend itself. And it's great.
The next
great
time
people.
The next time you visit, you should check out a company called iVeneer.
Okay.
iVeneer, they develop right in, I think probably the town that you've been there too, and they produce the template. So let's say a broken tooth, you
told me about that.
Yeah, you rough it up, put in the template inject it,
right.
The crown done. The tooth is done. No need crown.
That's
amazing
right.
Technology.
Yeah, fantastic. Yeah, I know. Yeah. Well,
Dr. Berger, it's fun. It's been it's almost like close to a year since we talked, but it's my an honor and a privilege to get to bring you back here.
Okay.
And I'm hoping that you continue update and share with us the next story. And thank you, Dr. Berger, for joining us on this podcast today.
Okay. Well, thank you, and have a wonderful weekend coming up. And thank all your people.